Welcome to Cyst Busting Saturday, featuring the work of Dr. John Gilmore, one of YouTube's favorite doctors. And please subscribe to see more videos of YouTube's best doctors.
So this is Gumdrop. Gumdrop. She's a notorious toenail story liar. She says she's only had this for a year, but I know it's been longer than that. Isn't that right, Gumdrop? Admit it.
Rolling?
Admit it. Oh yeah, I think we're rolling. Well, you can check. We might be.
Hey guys, how are you doing?
Okay. So we just put a little tourniquet on you here, so you don't have, suffer blood loss, hemorrhage problem or anything like that. And we're going to need another alcohol swab, please. Gumdrop, are you ready? Are you sure? You're going to feel a little stick, sting, and a burn, and Gummy Jean's going to spray some cold spray to help mitigate the discomfort. Look at that. A little bit lower, a little bit lower. Perfect. Little stick. Don't jump. You're doing perfect. Wow, that is so great. So you don't just have a nail fungus here. Let's get the other side, please, ma'am. You also have a really thickened, misshapen nail, which can be caused by trauma or by long-term infection. That's great. So you have onychomycosis, which is the name that we give to the fungus on the nail. But you also have a condition called onychogryposis, which is a misshapen nail, most often due to trauma, but in your case can be due to an extensively long period of infection. All right, so now we're going to give it another little shot. You got the second needle, please, ma'am? So we're going to let this medicine work for about a good 10 minutes. This is 1% plain lidocaine.
Yes.
We don't want to use epinephrine on the toes. So here we go. We're going to use the nail lifter first. This is a really oddly shaped nail. Look at that. I'm going to take it slow. You tell me if you feel any pain, okay?
Okay.
You really shouldn't. But, sometimes the anesthetic doesn't work as well as we'd like. Alright. That is a really thick nail. We've seen some that looked a lot worse. Really thickened, misshapen nails. And this is definitely one of them. So some of that stuff that you were saying was coming out from underneath it is just kind of some dead tissue that was stuck under there. But nothing serious. I don't think you have a bacterial infection here, okay? I think this is just a fungal infection. So I think that the antifungal medicine I'm going to give you is going to be real helpful. Just remember you have to get your liver function test done. See if it will forever leave you. Gumdrop. That hurting at all? Good. That came off pretty easily. I'll hand that off to you. Guess what?
You are toenail free.
You don't have a nail on that toe anymore. And I don't know if anybody can see really, you'd have to get in close, but there's actually some fungus on this nail too. The other ones are okay. But taking the Lamisil will allow your body to be rid of the nail fungus on all of them. So my guess is you went to a nail salon or someplace that wasn't doing a good job of keeping their instruments as clean as they should. Okay, so I wrote you a prescription for the Lamisil. And that's the antifungal medicine. You just take it once a day. And we'll have to do that for, it could be 6 to 9 months. We'll just kind of take it as we go. Gummy Jean's going to put a nice dressing on this for you. I want you to remember, don't let your toenail get wet for 3 days, okay? You knew that anyway, didn't you? Do you have any questions, concerns, comments as I remove the tourniquet?
No, thank you.
It wasn't that bad, was it?
No.
No, it wasn't. And like I said, Gummy and I, we're totally cool. We're
I'm
cool.
good.
Yeah. Okay, so you're going to put a dressing on it for you, and if you have any problems, you come back and let us know. Don't claim it, right?
That's right.
That's right. All right, thanks.
Bye. Hi guys, this is Gumby. Stay tuned for the Meta 7 video.
Hey guys, this is Vanessa, and I've been using Meta 7 for about a month now. It's really helped me since having a baby. I had a little bit postpartum, and I think after having it, after taking it, it made the wiring in my brain come back together. I feel like my old self, and I have a lot of energy. I'm not wired up or anything. It feels natural, and I recommend this product to everyone. So get your bottle of Meta 7 today.
Hey guys, Dr. Gilmore here. Thanks for watching our videos. If you like pimple popping and you've always wanted to do your own pimple popping, we've got just what you need. Super Pimple Popping Kit has everything you need to get the job done right. The instructions for getting your own Super Pimple Popping Kit are in the video description box below. Thanks again for watching.